that unfolded in downtown with the loss of life in the vehicular accident, and our thoughts certainly go to those who have been impacted by this terrible tragedy. Um, Moving on from that, for the what we're here today to talk about is how the county is going to proceed and move forward with the funding that's coming to us as a part of the American Rescue Plan. We've been in this pandemic for more than a year, and we are entering the recovery phase. We're seeing significant progress with vaccine administration, case counts remaining low, schools reopening, the prospects of fans in the seats for baseball, the possibility of descending tiers, the likelihood of descending tiers this week. And a part of this recovery process is going to be the infusion of federal help and support that's come into our region to help us not only fund the response to COVID, but also be a vital part of the recovery. The first time we did this, when it was CARES Act funding, we used that money for PPE, for testing, for childcare services, mental health services, internet services for remote learning, business stimulus, funds for food for seniors, families, and food banks. And we put a lot of intentional thought into how best we could utilize those federal funds at the time to respond to COVID-19. Now with the American Rescue Plan, I think we're going to be thinking about how we best utilize those funds to recover from COVID-19 and how we make strategic investments in a way that will meet the need of folks that are out there. And I think we're going to have to spend some time to really understand what is all of the federal help that is coming to folks direct, what is the state help that is there, and then where are there gaps, where are there things that are needed, and then also a recognition that the recession from COVID is the most unequal in the history of America. And we want to be mindful as we invest these funds that we are focusing them on the individuals that have been most impacted and will have the hardest time recovering, so that we can ensure a solid and smooth transition for all in San Diego County. We have an added advantage in the county in that we are on solid fiscal footing in the pandemic, and we don't have major deficits that have to be backfilled by utilization of these funds. So we think we're in a good position to really look forward and hear from the community about what are the priorities and things that they would like to see us consider for investment. As it stands right now, San Diego County government is set to receive $647.5 million. $647.5 million. There is another $611 million that will go to the cities throughout San Diego County. Unlike previous CARES Act, every city should receive some allocation of money direct. In previous iterations, it was just the County of San Diego and City of San Diego, but we have been told that every city will be receiving some. We expect to receive about $323 million of that in the next 60 days. And then about a year later, we will receive the second installment of $323 million. And so not all of these funds will be able to be spent immediately. Again, this is a longer kind of first tranche of payments and then second tranche of payments, with the first one coming, we believe, in the next 60 days, and then the second one coming a full calendar year after that. We will have until December 31st, 2024 to spend all of these types of funds. There are a number of things that we're able to do. COVID public health response, obviously, economic impacts, reduction in revenue, potential investments in infrastructure, premium pay for essential workers. These are a handful of the things that are allowable expenses. And we're going to be investigating in more depth what is allowable and trying to marry that up with the needs and ideas that we get from the county. Obviously, a fair amount of this money will already be spoken for. We definitely know paying for the public health response comes right off the top. We estimated, if you remember back into the year, that we were setting aside $100 million to fund our vaccine operations. I don't know exactly what has been expended to date, but obviously a considerable amount, standing up the 30 locations that you see countywide that are county administered or county partnership sites, along with helping fund a lot of that. Plus, we continue to pay for the testing network and testing system and all of the public health response. But we know that we're going to have significant cost incurred directly to COVID-19 response that will be paid for out of these funds. Our board has already agreed to set aside $30 million of this funding to help small businesses, particularly those that were required to shut down completely. And so we know that will be a part of it. And the board has discussed the possibility of doing hazard pay or kind of for our essential workers that have been out there on the front lines. But even after we cover all of those costs, there will be additional funds available. And we want to make sure that we engage with our community to hear directly from those that have been impacted by COVID-19, what ideas and suggestions they have, and then marry those with the funding available and what we're allowed to do. And so because of that, starting tonight, we have our first COVID-19 funding workshop. These are all going to be held virtually, and there is one for each supervisorial district. We have flyers that provide information for how folks can access these calls, but there's one tonight from 4 to 5:30. There's a second one tonight from 6 p.m. to 7:30. There's 2 on Thursday and 1 on Friday. Again, 5 of these that are designed for the 5 different supervisorial districts. And so I think after we get that community input, then the Board of Supervisors as a whole at a subsequent meeting will review community priorities, estimates of what we will need for public health, and we'll make the final determination on the allocation of the $647.5 million. Final point, I just want to let everyone know that rental assistance is being funded via a separate program, and we've extended the deadlines for submission of that to March 31st. It's about $100 million in state and federal money out there right now for rental and utility assistance, and the deadline for those funds has been extended. So if your household has experienced financial hardship directly or indirectly related to COVID, we encourage you to apply. Our rental assistance program covers everyone in the county except those in the city of San Diego and Chula Vista. Those cities have their own programs. And for information on that, you go to sdhcd.org. And then in closing, I'll just say it's been a long year, but we are working our way out of this. And vaccines are a part of that. And these funds to help aid and assist in the recovery are also a part of it. And I feel confident our economy is going to roar back and come back very strong, but we know that we have a lot of work to do. We have kids that have to be caught up in learning. We have businesses that have to rebuild. We have a lot of work in front of us as we move forward, and we're committed at county government to doing everything we can to help San Diegans. So with that, I would be happy to take any questions.
I have a question, and I'm sorry if you addressed this briefly. I got kicked out. My laptop crashed. So
Oh, no worries.
Technical difficulty.
That happens.
I know that the eligibility just opened up today for people with underlying medical conditions.
Right.
And there's some discussion. I know my colleague Priya asked at the county briefing what you were doing to be able to kind of be sure that people who were showing up really did have these conditions. And you mentioned some sort of documentation or attestation. Yeah. Could you just clarify? I tried to check the county website, but I wasn't sure where that form was.
So thank you, Alexa. So what initially we were going to do is require some form of verification or documentation. That has been superseded by new state guidance, and it's basically a self-attestation. There's a concern that individuals with underlying health conditions who maybe aren't a part of the normal healthcare system would have challenges producing that. If you don't have a doctor, it's really hard to get a doctor's note. And so in an era where we are trying to tackle issues of equity, essentially individuals will just self-attest that they have one of the underlying health conditions. And so we will be relying on the good nature of San Diegans to not show up for an underlying health condition unless you actually have that underlying health condition. Yeah.
So, Supervisor Fletcher, this is Daphne Watson calling.
Hi,
speaking. I just had one quick thought, and then it may not be on anybody's radar, but some of the families that we're working with in our agency have lost someone due to COVID, and they don't have costs for burial services and those kinds of things. Especially there's a family we're working with, a young girl who their family, they lost a parent, and their only parent was the caregiver, and now they're trying to figure out what to do. So is there any allowance or any, it may not have been on anybody's radar, and I understand that, but there are individuals in the community who are struggling with trying to pay for burial costs for loved ones. Is there any consideration for that?
That's exactly why we're doing these public hearings, to get ideas and suggestions like that. And so we will make sure you get the info on how to join the meetings. And I mean, I've heard it now, and I'm happy to inject that as an idea to be considered. But that's why we're doing these 5 separate public hearings, is to get ideas like that. So it's not just a repeat of what another jurisdiction's doing or a repeat of what we did before. We really want to assess the impacts of COVID and how we can most appropriately respond. So I think that'd be a great idea to be considered. And I think we'll get a lot more ideas than just what we've done before from these hearings.
Thank you so much. I appreciate it.
Yes, ma'am. Thank you. All right. Any other questions?
Yes, sorry.
Uh-oh, you got a little echo going. Oh, I can't hear you now. You muted. We'll give you a second. We'll give Deborah a second here.
Yeah, I'm not sure.
Uh-oh, you still got your feedback. Do you want to type it? If you type your question in the chat, I'll answer it there. So Deborah's question is, how much of the 645 million is accounted for and how much is to be decided? Deborah, that we're assessing that now. That's a part of this process. We're doing the public hearings to get ideas on what we would spend the funds on, while we simultaneously assess how much we will need for the public health response. Obviously, those funds directly tied to COVID is what we will do first. And so I think a not insignificant amount will have to be dedicated for vaccinations, for the ongoing testing efforts, for public health response. And so I think in the coming weeks, we will have better clarity into how much of that will need to go directly to the COVID response and how much will be available for COVID recovery. But we don't know today.
Supervisor Fletcher, this is Daphne again.
Yes,
Is
ma'am.
there a possibility for ongoing testing for students at schools, especially like middle schools and high schools, as
Yeah.
well as teachers?
I imagine we will continue our testing program for quite a while. Cool. How the funds may accelerate vaccinations. So I actually don't think these funds will accelerate vaccinations. The only thing that will accelerate vaccinations is more vaccines. These funds will help us pay for all of our vaccination efforts. We made a choice as a county early to make an early initial investment to build out the infrastructure before we had any state or federal funding for it. And a part of that is why I think San Diego is so far ahead of so many other counties and how many vaccines per person we've been able to invest. So these funds will likely pay for things we've already done around vaccinations, and they will pay for things that we have to do between now and when everyone's been offered a vaccine. But the real speed of accelerating vaccinations is just going to be dependent upon increasing supply of vaccines. And so we will see, hopefully we will see an uptick in the coming weeks. I'd hoped we would have seen a significant uptick by now. We're gonna have to be a little bit more patient. But our case numbers remain low. Vaccines, we continue. If you go to the dashboard, we're doing a really great job of getting vaccines in arms as quick as we get them. And I have a high degree of confidence that when the numbers come out tomorrow, we will have our second week in the revised red tier. And feel confident that on Wednesday morning, we will officially move into the red tier, which again is another powerful step forward that will aid, particularly help to our restaurants, our gyms, but also changes some of the things around schools and other things. So I think it's going to be another powerful step on Wednesday. We'll know for sure tomorrow. So with that, let me ask if there's any final questions. If not, I appreciate everyone's patience as we, yeah, Alexis.
Just because you just brought it up, the supply, you said you had hoped it would be here by now, but we're going to have to be patient a couple more weeks. Is the supply enough, you think, to support expanding the eligibility to all those underlying medical conditions? And if not, how does the supply look right now in terms of
Yeah,
being able
no,
to-
there's not, that's a great question. Like there's not enough supply to meet the demand right now. We are opening for underlying health conditions, but there is going to be tremendous pressure and strain on the system to get an appointment because the vast majority of what we get are going to second doses. And so there will be very limited first dose appointments, and we are adding a significant number of the population that is eligible for those first dose appointments. Now, we believe in the coming weeks it will increase significantly, but we can expect a lot of frustration. You're going to have a lot of folks that are eligible for very few available vaccines. And so we just ask for folks' patience. We can only make appointments available for vaccines we get. And we're going to continue working through this. I think it'll stabilize in the next few weeks, but the numbers we're getting this week are not significantly greater than what we got last week. And so, you know, I hear the president say everyone will get a vaccine by May. That we really need to start ramping up if we're going to meet that goal. And so I'm hopeful that the president saying that means he knows that the manufacture has increased and the distribution is going to increase. But that increase has yet to arrive in significant forms to counties. So I think we're going to need people to be exceedingly patient, and that you still have food and ag workers, some maybe emergency responders, some education folks that are still going into the system. And now we're adding a significantly larger number of folks. And so there will be a shortage of first dose appointments for a while. Yep. Cool. All right. Thank you, everyone.
I had